Good afternoon, everybody. My name is Evan Stewart, and today we will explore a fascinating case study examining how a Norwegian tertiary hospital managed its internal crisis communication during the COVID-19 pandemic, with a particular focus on the effectiveness of different communication channels and strategies. Picture those first couple months of 2020 in hospitals worldwide during the initial phase of the pandemic. Medical staff desperately needed accurate information, yet traditional communication systems were stretched absolutely thin, with most healthcare workers working days on end without a break. This research dives deep into those challenges, examining how one hospital adapted and evolved. What they discovered about effective communication might surprise you. Understanding these patterns helps build more resilient healthcare communication systems to enable them to be prepared for future crises. Our case study examines a Norwegian tertiary hospital that, like many others, had to transform overnight during the initial phase of the pandemic. Their transition highlights how healthcare organizations adapted while trying to maintain effective operations. On March 9, 2020, they activated emergency protocols and established a COVID-19 task force, fundamentally changing their communication structure overnight. This rapid reorganization demonstrates the importance of flexible organizational structures during crisis response. It's time to dive deep into the data. If you know me, you know I'm a big data-driven person. This study balanced perspectives with a carefully selected group of 19 medical professionals and 3 business experts. The experience distribution revealed fascinating insights, with 13 participants having less than 5 years of experience, 4 with 5 to 10 years of experience, and 5 veterans with over 10 years of experience. This representation encompassed every single level of the organization: 4 from central administration, a COVID-19 task force member, 2 division leaders, 4 department heads, 8 section leaders, and 3 operational staff. The researchers employed sophisticated mixed model social network analysis alongside qualitative interview data while using subject-oriented business process management to visualize communication flows and identify information bottlenecks. This multi-layered approach captured both the quantitative patterns and human elements of crisis communication. The transformation of communication structures revealed a fascinating evolution of hospital operations during crisis. Traditional top-down channels merged seamlessly with new lateral pathways, while the 6-person COVID-19 task force emerged as a crucial information hub, processing an impressive 70% of critical communications. The central administration demonstrated remarkable adaptability, maintaining strategic oversight while enabling direct department-to-staff communication channels. Emergency protocols catalyzed the creation of new communication pathways between previously separated units, breaking down traditional silos. Perhaps most notably, the traditional hierarchical reporting structures became more fluid, allowing for rapid information flow during peak crisis periods while maintaining necessary oversight protocols. This adaptive approach proved essential for managing the complex demands of pandemic response while preserving organizational integrity. Look at how these 3 elements interweave into a comprehensive crisis communication framework. The contextual capability proved to be twice as effective as traditional speed-focused approaches, with data showing an 80% effectiveness rate for contextualized information transmission. Channel balance emerged as the critical bridge between different organizational levels, while system flexibility enabled rapid adaptation to changing crisis conditions. Notice how each component builds upon the others to create a more resilient communication framework, particularly in how the hospital balanced synchronous and asynchronous communication methods to maintain information flow without overwhelming the staff. The research revealed that departments using multiple complementary channels showed 40% higher information retention than those relying on single channels. Three critical discoveries emerged from this research. First, context outweighed speed by a factor of 2. Second, successful communication required balancing multiple channel capabilities. Third, and perhaps most surprisingly, flexible communication channels proved absolutely essential for reaching all organizational levels. These insights demonstrate how thoughtful communication strategies can enhance organizational resilience during crisis. Based on these findings, several practical recommendations emerge. Think of communication channels as tools. Each has its own optimal use. Success depends on matching channels to both message type and audience needs. The research shows that considering your audience's needs is just as important as the speed of delivery. Strategic channel selection creates more effective and sustainable communication systems. Let's consider what makes communication truly accessible. Information needs to flow seamlessly between the boardroom and the emergency room. This research demonstrates how the right combination of channels can bridge organizational gaps effectively. Successful crisis response requires adapting communication approaches to meet diverse stakeholder needs. Drawing everything together, several patterns emerge about effective crisis communication. Strategic channel selection, balanced information delivery, and maintaining multiple communication pathways all contributed to success. The COVID-19 task force's effectiveness particularly highlighted the value of adaptable communication networks. These lessons extend beyond healthcare to crisis management in any complex organization. As we conclude, observe how the findings challenge conventional wisdom about crisis communication. The emphasis on contextualized information over speed offers a new perspective on effective emergency response. These findings offer valuable insights for any organization refining its crisis communication strategy. The clear relationship between channel selection and effectiveness provides practical guidance for future crisis preparation. Together, we've uncovered how effective crisis communication in healthcare isn't just about speed or quantity of information. It's about creating meaningful connections across all levels of hospital operations. I hope one might consider these insights and how they might transform your approach to organizational communication. Thank you for your attention to this article.